Morning. This morning we're talking to Erica Loesel. She is our morning co-op at Auburn Optical in Auburn. As I'm sure you all know, we get the absolute best co-ops here at the office, and I'm so proud to have Erica on staff. Today she is going to be talking about blepharitis, an infection of the eyelashes. So here we go. Erica, take it away.
So I will be presenting on blepharitis. So blepharitis is inflammation of your eyelid, mostly where like your eyelashes grow. So as you can see in here, it'd be like down in here. So this is like an example of blepharitis. This inflammation would be right here where the eyelashes do grow. So this occurs when tiny oil glands near the base of the eyelids become clogged. And although it looks kind of nasty, it is not contagious. So you don't get one of those pesky letters sent home from the elementary school saying that your son or daughter has a contagious eye condition. So this is not one of those. Okay. So symptoms include you could have watery eyes, some red eyes, maybe some itchy eyes, some greasy eyelids, definitely some crusted eyelashes. Like you can see in here, you really have that flaky skin build up in your eyelashes. And you could also have some swollen and red eyes. As you can see here, it is very swollen and very red. So some complications that do go along with blepharitis are that you can have some eyelashes that fall out or maybe grow abnormally, some excess tearing or dry eye, possibly some scarring after the fact from the condition. The blepharitis could lead to a corneal ulcer in some extreme conditions, or it could maybe even lead to a stye in your eye, which I have an example right here, this little, it's the bump right here on your eye, the red bump. And it also could lead to conjunctivitis reoccurring if you are prone to that. So after blepharitis, the inflammation and redness could lead to conjunctivitis in the end. Okay, so some causes of blepharitis include some dandruff of your scalp and eyebrows. You can maybe even have a bacterial infection, or you could have eye lice, which is kind of a different condition. You could also have an allergic reaction to maybe the eye medication that you're using, a contact lens solution that maybe isn't working for you, and even maybe your favorite makeup product could be causing you this bacterial infection. So a comprehensive eye encounter with your eye doctor will be perfect to diagnosis, and you can even have a sample taken of it, and they can maybe analyze it for bacteria or an allergy and have it tested. So treatment for this includes washing your eyes. We really want those eyes to stay clean as much as we can, and for those we have the lid scrub wipes that we love, and they really help to just get rid of that bacteria on your eyelids. And we also have a warm compress called Bruder mask, and those really help to just soothe your eyes and really combat that redness and irritation. Also, we could prescribe you a medication that fights the infection, so possibly like a eye drop or eye ointment, maybe an eye cream, or even an oral antibiotic could help. And then lastly, there are a couple tips to prevent blepharitis. So first of all, make sure you guys are just practicing good self-hygiene. Keep those eyes clean. They are really important to your overall health. Also, you could try using an anti-dandruff shampoo so you don't have that buildup of the skin and the flakiness.
But not in your eyes, right?
Right.
Okay.
Keep that on your hair. And then lastly, make sure you guys are removing all of your eye makeup before bed, because that does get really nasty during the night when that bacteria does build up. So lastly, I just wanted to talk about the model I do have here. So as you can see here, this is a perfect healthy eyelid. You got those nice black eyelashes, the normal skin tone on the lid of the eyelash.
Tell me what's on the side of it there, closest to your hand.
So this is a meibomian gland. Did I pronounce that right?
Yeah, meibomian. Okay. Well done.
Yes. So that helps to keep the tears in your eyes and prevent the excess drying out. So over here, I have an eyelid with blepharitis.
Okay.
So as you can tell between the different shades, this is really red compared to this one.
I see that.
Yep.
It looks inflamed.
And then this is a stye that could result from the blepharitis, this bump here. And then lastly, we have the crusted eyelashes. See if that flakiness.
And you know, believe it or not, that looks pretty close to what it actually looks like.
Yeah.
It can look pretty nasty.
Yeah, not fun. Definitely not fun.
So just a word to everybody real quick about the best regimen for cleaning up your eyelashes. I find that the Bruder mask, which is a warm compress, used on the eyes for about 10 to 15 minutes really loosens up those bacteria and loosens up that discharge area there. And then when we use the lid scrub, it really cleans it off. So if we do nothing else, a lot of times we'll prescribe a Bruder mask, which is a special type of medical warm compress, and lid scrubs. And that really seems to turn the corner for the vast majority of the people. But come in for an eye exam. If you get any of the crusty stuff in your eye in the morning, that's definitely a sign you should come see us. If your eyes feel like they're dry and yet they burn and they're oily at the same time, that would also be a sign of a blepharitis. So come see us. Erica will get you prepped for your exam. I'll diagnose it and we'll get you fixed up. Thank you so much. Have an amazing day. Again, this is Erica Loesel. She is our co-op at Auburn Optical, and I think she did a fantastic job. Thank you, Erica.